Hello and good morning. This is Kuldeep Chaudhary from Health in India. As India celebrates its 66th Independence Day, we are here at the residence of one of the most renowned, iconic general laparoscopic surgeon, Dr. Subhash Khanna. It's a great pleasure talking to a person who's devoted his entire life for providing quality health care to the residents of Haryana. In the southern part of Haryana, he's worked not only with the government sector, but has been instrumental in establishing some of the state-of-the-art healthcare institutions. Good morning, Dr. Khanna. Good morning, Mrs. Khanna. As India completes 65 years of its independence, it's a great pleasure to have you with us. Dr. Subhash Khanna, you've had a life which is beyond comparable. Today, you're one of the, not only the most respected, but one of the most sought after general surgeons in the city of Gurgaon. The institution of Kalyani Hospital, which you have created in the last 15 years, your career spanning over 3 decades in which you have done probably more than 30,000 surgeries, you have probably touched every household in this state of Haryana. Let me begin by asking, it's been a long journey, there have been must have been many ups and downs during this. Today when you look back on your journey of, 60 years?
62 years.
62 years of your journey. What memories do you have of the very early days? Did you ever dream that you'll become such a renowned surgeon one day, 62 years later?
I definitely thought of to serve the humanity in the health as it is services. My school was just near the hospital, government hospital. Whenever in the last time we used to see on peeping the side of the hospital, we used to see a lot of people sitting in the line and just waiting for the doctor to come. There were hardly only one doctor used to be there. But when the doctor used to come, they really used to wish him, bow their heads saying, Bhavanji Aage, Doctor Aage. You used to really see what importance the doctor has got in the society. This is what gave me impulse to be a doctor.
So those were the days when doctors were just, another avatar of God, and people used to worship the doctors. That motivated you to go into the healthcare and become a doctor yourself. Tell me a little about your childhood. You were born, where were you born, and any memories of...
I was born in Kathak.
Okay.
My father, the dad as a headmaster, he was only interested that I should study. I belong to a just educated family. And the main thing was, I was very fond of playing, and moreover particularly the glass balls and the flying kites was my favorite.
Okay, and so this 15th August you must have been a memorable day.
Even today I enjoy the flying kites.
Okay. These days we see very few kites flying, but when I was young, 15th August used to be a very big day for kite flying. So tell me a little more about, the childhood, your siblings, how many brothers and sisters you have?
I am the youngest in my family. We are 3 brothers, 3 sisters.
Okay.
And being the youngest, I had all the plus to enjoy my life. Everybody used to come and say, what do you want? And I used to get the things. And I was very casual in my studies in my school life.
Okay, so you've had a very, enjoyable child. You've studied at Cathal?
Yes, I did my pre-medical in Cathal, RPSD College Cathal. From there, I went to medical.
Okay.
I was the first batch student going to medical college from that college.
And when did you move over to Gurgaon after finishing your education?
After finishing my MBBS, I joined the state service. I joined in Bhiwani. I started my career as house surgeon in Bhiwani in 75. Then I joined as medical officer in Bhiwani. I liked the doctors over there so much. They were so intelligent, they impressed me a lot, and I used to work hard over there. I used to do all the surgeries, even being MBBS.
Okay.
This gave me impulse to do the post-graduations.
Okay, so after finishing your medical school, you first started working and then you did your post-graduation
Yeah,
and
through
research.
service.
Okay, the medical college you passed out in the year 1975
Yeah.
and then you joined again Rohtak Medical College for the MS?
Yeah. I think first I did diploma orthopedics.
Okay,
Then I joined as registrar in orthopedics.
okay.
Then I shifted to MS General Surgery.
This is a very unique thing. Very rarely do we see, you know, a person having twin qualifications. You're one of those rare persons holding a degree in orthopedics and then going on to complete your masters in surgery. Has this helped you in your private practice?
Yes, it has helped me, particularly dealing with the accident cases. I used to manage the cases in total, and the orthopedics and the general surgery both parts. And patients were helped like anything with the knowledge of that both the subjects in a good extent.
Especially in the government hospitals where, you know, finding quality doctors is so much more difficult. If just one person can do, you know, cover up so much of the work, so that must be really extra work and extra pressure on you, you know, handling both the orthopedic and general surgery patients.
Basically, this is my hobby and this is my profession. I used to enjoy it.
So you are a doctor 24/7. You
I used to work like this, and when I could, I work for 14 to 16 hours a day.
Yeah, I hear this thing that you know, Dr. Khanna could be seen at any time of the day or the night, you know, seeing patients at Kalyani Hospital. Whenever an accident patient reaches to the hospital, and Dr. Khanna is within minutes doing the rounds there. So, good afternoon, Ma'am Vibha. Let me bring you into conversation. When did you meet Dr. Khanna? When did the Cupid strike?
Of course, it was an arranged marriage.
Okay.
So it was after marriage.
So you belong to Cathal or
No, I belong to Faridabad.
you belong to Faridabad? So it was a marriage fixed by the parents.
Yes.
And were you working when you got married?
Yes, I was working.
Okay, so you started your career in the teaching profession, and nice to know that both of you are in such a noble profession. One is helping patients, the other is helping build careers. You're today the vice principal of the Girls Government College, which is right opposite where Dr. Khanna works in the city of Gurgaon. You must have had almost a 20-year career. What the 30-year career? Were there any time when you know, the pressures of work created any kind of problems between you?
Pressure of my work,
No pressure of his work.
his work. No, I was well prepared because I knew doctors, especially surgeons, they are dedicated and they should be dedicated to the patients. So I could manage it.
So basically, the surgeons need to have a key to the house so that they can leave at any time and enter any time.
And that's why he was also quite cooperative. He could take cold food, whatever was available because I was working, so he was quite cooperative.
Yeah, that I've seen Dr. Khanna, you know, some of the days at about 5 o'clock he's saying, I'm going to have my lunch, and you know, we are astonished, we finish our lunch 4 hours before that time. So, your early days of your marriage, was there any kind of struggle or, you know, shifting places and...
Yes, being in government job, he had transfers along with having kids. Both were in government job, and he was supposed to actually have his PG degree. He was very keen to have MS. So he got transferred to rural area. Then he prepared for his entrance exams. He cleared it. Then he was in medical college, Rohtak Medical College. So that was a struggle period, of course, in both ways, economically as well as managing the house.
managing the house. And you got your first child before he finished his MS?
Yes.
So when he was at Rohtak, you were posted somewhere around, or?
Yes, I was in yes. I could manage actually. Wherever he was, I could manage to be with him.
Okay, and finally when he landed up in Gurgaon, so you have landed up
Yes.
in Gurgaon. So working right opposite his workplace, Dr. Khanna, don't you feel husband and wife should be working at least some distance apart? She must be keeping a close
I
eye.
never feel.
We don't meet. We meet only at home.
I asked her to come, but she never comes to that place.
Okay, so she's been, giving you a pretty long
Yes,
rope
I-
to have the fun of your life. Anyway, it's nice to know, after you've been married for now almost 30 years, so much of camaraderie, understanding, existing between you, giving space to each other. Tell us something about, the kids grew up and did you choose a profession for them? Did you try to make them doctors?
You see, my eldest daughter is MBS Olds. I love her to have best is now doing this super specialization. My second daughter is engineer.
Okay.
She never wanted to be doctor. And they saw my life and they were saying, it's very hard and tough. And now she is married to an engineer. She's now major HR. And my son is a doctor. He opted for it. He said, okay, I can remain empty stomach, I can have sleepless night. But I also was happy to know that he is interested to go in this line. Because this line needs this much sacrifice. Otherwise there is no fun of going to this line. If you have got passion for this, nothing like this profession.
So basically, there's obviously a lot of hard work behind every successful doctor, and the only thing that keeps them going is the satisfaction that they derive, that smiles on the faces of their patient. You can make money in any profession, but you never actually come in such close contact where your works and its results are being displayed. So your son is now doing specialization in
He is now just waiting for the entry to the specialization.
He wants it.
Okay. So is he inspired a lot by your life and your work?
Definitely, this is why he is opting for it.
You see, he was very easygoing in his childhood. So I never wanted. I thought he won't be able to cope up with the profession. So I told him make commerce or some other stream. But he said, don't underestimate me. I can work harder than my father. And actually now I have seen he's very hard.
So like father, like son.
He wants to.
And what kind of mother you have been? A disciplinarian? Mostly we see that the parents who are in teaching profession, they're very hard on their kids.
Not so hard. I had to manage in both the ways because he was not available all the time with children. So I used to scold them, I used to pamper them.
So today looking back, you feel satisfied, have a feeling of satisfaction that the kids have all got settled well, and this has been a nice parenthood for you? Okay, Dr. Khanna, you established Kalyani Hospital along with Dr. Khurana in the year 1997, and since then Kalyani has been the numero uno hospital for the city of Gurgaon. Did you face some challenges or difficult times at the time, in the initial years or before setting up of this hospital?
Basically, challenge was how to retain the patients because Safdarjung, All India and Gangaram all were just 20 minutes away from this place. And everybody just making this issue to us, telling us why you are spending the money, people will not stay, but we have confidence in ourselves that we can give the service and we can retain the patients. And this is what happened.
So, those days, the place where Kalyani Hospital came up was sort of outside the city, and today that is the heart of the city. Location-wise, I don't think any other hospital in the city has a better location than Kalyani Hospital. So, has there been any, role for good luck, good fortune behind you during this 15-year journey?
This was our hard work and sincerity to the profession which has given us everything. It was not the location which pays us much, but it was the services and the reasonable. We were always try our best to be with the masses. We always try ourselves to keep the treatment just at affordable price for the masses.
Dr. Khanna, today we see, Fortis Hospital has just opened up and they have, poached upon the neurosurgery team of Max Hospital. When Medanta opened up, they raided virtually every hospital from Gangaram to Apollo. And there's this massive movement amongst the doctors from one hospital to another. Most of your doctors have remained the same over the last 15-year period. What is the secret behind this success of being able to retain your doctors?
We never put any pressure on our consultant. We give free hand to do their professional skill with the patients. And we always help them. If they want to do any charity to any patient, we want to give any discount, we feel happy. If some poor is there, they want to help, they have got full hand for this from our end. And we keep a homely atmosphere. If there is any problem with anybody, we just want to share it.
So there's been this debate going on, that the doctors would always like to work for a doctor entrepreneur rather than for a corporate house. Dr. Naresh Trehan has successfully proved that the best of the doctors say that they like to work for another doctor. Do you think that the doctors should now take a more active role as an entrepreneur rather than letting the corporate houses
But particularly in the health sector, if doctors come forward, that will be the best thing for the public and for the doctors both.
So, what is it that prevents the doctors? We see most of the healthcare in the secondary segment is, there you see the doctors as the entrepreneurs. But when you see the top-end hospitals, they're mostly the corporate houses. Is it the lack of capital or is it the lack of risk-taking capability?
Lack of capital may be a small part. The lack of risk-taking capacity is the main drawback.
So corporates have deeper pockets. They are capable of, risk that.
And they can buy, you see.
Okay. Dr. Khanna, this has been a wonderful journey. I'm sure you're not going to hang your gloves anytime soon. You are still very active, capable of working for 15-16 hours on a daily basis. I think your life has been worth emulating for lots of aspiring people who wish to go into the medical profession. The journey is not easy, but the satisfaction that you derive from the smiles on the faces of the patients whom you treat is something worth living for. On behalf of Health in India, we wish you many, many more years of success and we hope that you keep serving the people of Gurgaon with the same selfless spirit as you've done in the last 30 years. Thank you, Dr. Khanna. Thank you, Mr. Prabha.